Good afternoon. My name is Dr. Khaled Abu Haleeqa. I'm the Vice President for the Emirates Society of Ophthalmology. Welcome all. Today we are interviewing a prominent oculoplastic surgeon coming all the way from United Kingdom, Dr. Ataullah, who works at the Manchester Royal Eye Hospital. Welcome, Saj. How are you doing today?
I'm doing very well. Thank you, Khaled, for inviting me to ESO 2024.
Thank you very much. I want to ask you, Saj, how is your experience in the conference?
Well, it's my second conference that I've attended in the Middle East. I was here last year, kindly invited by you for the WASOPRAS World Oculoplastic Congress in Dubai in May, and now subsequent to that, I've been invited here to ESO, and I've been hugely impressed with the organization of the meeting, the sophistication of the technology, how well the technologies all worked together. You know, the meeting hall with the two sessions running side by side, with the headsets, all of the audio and the visuals have worked seamlessly. And it's very rare to come to a conference and all of the technology work so well together with the talks. So I've been very, very impressed with the quality of the meeting, the quality of, you know, simple things like the food. The food is outstanding. And whenever you go to a conference, you always remember those little things, those quality of the drinks, the service, the food, because it has a big impact on your overall experience. So it's been very, very, very impressive, actually.
Oh, so from all aspects, even the food you like?
Hey, the food is important. I'm very keen on my food, and so if I'm satisfied in that respect, you know, then you're 80% there already.
Yeah, happy to oblige, and we cannot have enough of your side, so we'll be inviting you a lot. So, what did you think of the program in particular? I know we have different aspects. We have, you know, the main hall and the nobility hall as well, workshops, wet labs, as you mentioned. But within the oculoplastic, which is your field and my field as well, within the oculoplastic program, how do you feel the program has run?
Yeah, I think both of the main oculoplastic sessions that I was involved with, the Friday night session on eyelid surgery and the orbital session, the My Eye is Bulging session, they worked very well. There was a good variety of topics covered from different angles, from different speakers. There was a good opportunity for discussion as well. Often you go to meetings and there isn't enough time for people to discuss subjects, and then they reserve discussions, you know, for the coffee afterwards. And there isn't often enough time. So having that opportunity to discuss things is really important, you know, rather than just dominate the session with the talks, giving not enough time for people to ask questions and to engage. Because as you know, Khaled, it's often the discussion around the subject that's the most important. And so I think the meeting has given really good opportunity for people to do that. And I was really impressed with the lacrimal session this morning, with the cases, the broad spectrum of cases that are being discussed, and the ability, because it was a smaller environment, but it gave ample opportunity for the audience to engage with the panel and the speakers. So I particularly enjoyed the lacrimal session this morning as well.
I think it was good. Maybe if we had it a little bit extended in time, would you say?
Yeah, I think the thing about lacrimal surgery is that there are so many aspects to it, and it's a difficult subject. You know, Khaled, we have 3 fellows. We have run a fellowship program in Manchester. We have 3 fellows, and every time a new fellow arrives, I will say that although we manage lots of different conditions in oculoplastics, whether it's trauma, infection, tumors, the subject that I find most difficult to manage is the watery eye. And that's because there are so many different factors that contribute to that simple nuisance of a symptom, epiphora, and there are so many things that you have to take into account. And so because there are so many factors, then the discussion around watery eyes and management of epiphora is quite a complex discussion. And the counselling that you have to offer patients when you give them the opportunities for different interventions, that's also a very complex discussion as well. And so I think it would be useful in subsequent meetings maybe to have a more extended lacrimal session, but with the same setup. I think the format was very good.
Yeah, that's good. Can I ask you, did you get a chance to see Abu Dhabi?
So unfortunately not so far, because I arrived on Thursday night, and I've got a little bit of jet lag that's having an effect. You know, you come from the UK and you lose 4 hours, and it would be I did visit briefly last year when I came to when I came to Abu Dhabi, and I saw a little bit then. I was taken out to a restaurant in the evening, but I would love to see some of the other places. I'd love to see the Louvre as well. You've got the Louvre in Abu Dhabi as well, haven't you?
So please, you have an open invitation from me personally if you want to come at any time into Abu Dhabi, regardless of a conference, to show you around. That would be my pleasure.
I'd love to do that.
Thank you.
Yeah.
It will be my extreme pleasure. One thing I want to touch on, I know you are running a dissection course back in the UK.
Yes.
I'd like to know more about it, please.
So we have a dedicated dissection surgical skills and simulation centre in Manchester at the medical school. And so in a lot of places you go, there's an anatomy lab that's attached to the medical school, and that is sometimes used for cadaveric dissection. The beauty of the laboratory in Manchester, it was set up specifically for surgical skills training and simulation. And so that is a dedicated laboratory with endoscopic stacks, with operating tables, with operating headlights. So it's fully adjustable as if you are in an operating theatre. So it gives the most realistic experience to the delegates for conducting a surgical procedure, but not on a live patient. So I think it's probably one of the places where you can get to the closest possible to practicing on a patient without doing live surgery. So it's a fantastic opportunity for people who are training, for even senior surgeons who wish to practice a new technique, a new technique that they haven't done before they start to operate on live patients. And so we've been running a specific 3-day oculoplastic, lacrimal and orbital dissection course with using cadaveric heads. And in my whole annual calendar of work, it is genuinely my favorite time of the year, because although it's a lot of hard work putting it together, I invite all of my favorite oculoplastic colleagues from around the country, around the UK, and we all have the opportunities to get together for 3 days. We socialize, we meet delegates who come from all over the world. And it's a great opportunity to meet people from other backgrounds. And so we have a lot of people from the Middle East, we have people from Europe, from South America, and it's a really good opportunity, although it's a very intense few days, because obviously when people are coming from such a distance, they're paying to attend the course, you want to maximize their surgical opportunities. So that's what we try to do. We minimize the teaching, we maximize on the dissection, whether it's the demonstration of the dissection or allowing the delegates, the dissectors. But we also have observers. As you know, last year at Wasopris, we ran a very similar model where we had dissectors who paid to attend and dissect, but we also had observers who came along to listen to watch the demonstrations and the dissection and have the opportunity to discuss. So it's genuinely something that when I was training, I didn't have the opportunity to do, but it's something that, this is becoming more and more popular around the world. And it's a genuinely great opportunity for people
Can I
to learn.
ask you, it looks like a wonderful course to attend, and I'm sure our audience want to know how to register for it.
So there's a specific website. The course is called the Oculoplastic Dissection Masterclass. And so there's a specific website called oculoplasticdm.com. Okay. And so anyone interested can go onto that website and they can register their interest, and then they can be put on the list. So we just ran the course for 2024 just a couple of weeks ago. So now we will be registering interest in the next course, which will be early 2025.
Excellent. Happy to hear that. Saj, would you want to come again to the EASL conference in the future?
You know, Khaled, I've been so impressed with every aspect of this conference. As I said, it would be an absolute pleasure to come here and join you for ESO again in the future.
Okay, on that note, with this promise, we'll close this interview, and I thank you very much.
Pleasure, Khaled. Thank you so much for inviting me.
Thank you, my audience, this afternoon for your attention, and we look forward to seeing you in our next conference, 2025.